Yeah, what up? You know what it is. Styles P the Ghost giving a shout out to my man, my dog. Make sure you tune in. Feel what we are trying to do.
Music.
What up? It's your girl Justina Valentine, and you're rocking out with the Matrix Studios Network. You know they're bringing you the hottest new artists, making the underground mainstream. Check them out at www.thematrixstudios.com.
All right, we back in the building. You already know what it is. This is the producer's point of view. I am your number one producer, the podfather of this internet radio game, 25 years strong. And I'm always happy when I got a doctor in the building, because that means there's somebody that knows a little bit more than what I know. I said a little bit more, right? But I know it's a lot. Don't mind me. I'm just talking trash right now. But right now, introduce yourself to my audience and internet world and radio world at large.
Okay. I'm Dr. Ebony January, board certified OBGYN, author, health advocate, businesswoman.
And that was a lot, but I know there's a whole lot more to it. And before we get into it, I got to get into the name. So January is is that your last name?
That is my last name.
Government?
I was not born in January.
You wasn't born. So let's clear that up. She wasn't born in January, people. So, all right. So where did it all begin for you? Let's go back, and then we'll come back forward. So before you was a doctor, what was your claim to fame in this world?
Well, just being born.
Just being born.
Just being
okay.
born. I'm originally from East St. Louis, born in St. Louis.
Shout out to the Lou.
Yeah, the Lou. Shout out to our folks in the Lou. They're struggling with the tornado. So that's,
that tornado was a little bit crazy. Yeah.
I was there when it happened.
Really?
So yeah, it was tough.
So walk me through that, because I've never been through a tornado. I've been through a Hurricane Katrina in Florida.
Oh really?
And that was a little bit crazy, because I drove down there to see a girl, which I don't know what I was thinking about in the whole storm. But tell me about this tornado.
Yeah, it actually happened really, really fast. There were some political issues surrounding it, because the sirens didn't go off in the city. And so a lot of people were concerned about why didn't the sirens go off, and it hit in the city. And typically how St. Louis is set up, when we've had tornadoes, it's mostly been out further.
Right.
So it hit the north side and the west side of St. Louis, and it was very quick. And then right afterwards, it was beautiful, but the destruction was definitely there. So many people, still without power. Some people still without homes, and now they're coming and demolishing.
So now they're still.
Yeah,
I heard that there was no warning, because tornadoes drop down and they just touch down.
It hit very, very quickly in 2 locations, and it was really scary. So we need help. So for those of you who are listening and watching, we definitely need help. So definitely find a way to support. You can DM me as well.
Right. Give out that information too, because that is something communities definitely need to get involved.
Yeah, 100%. So my Instagram is Dr. Ebony January. That's doctor spelled out, Ebony with an I, January like the month. But you can DM me, and I can connect you with organizations that you can support, or you can email me at drej@drej.com.
Okay. So, all right. So now, like I said, when you were born, we started off when you were born, but let's go into high school and going into college. Was being a doctor your main path? Did your parents position you to be a doctor, or was this something that you was passionate about from maybe playing with your doll babies or something like that?
Right. It was something that I was passionate about. Actually, it was twofold. So my grandmother had 14 children, my dad's mom, and to watch her, someone who had given life to 14 individuals, to watch her body slowly deteriorate. She had multiple strokes and things of that nature. That really had an impact on me with regards to health and what the human body could do, especially a woman, someone who had given life to many individuals. At the same time, when she was deteriorating, my stepmom was pregnant with my youngest sister. And so to watch someone become pregnant, or not become pregnant at the time, but to actually see her body change, and now a life being brought in that didn't exist, like that to me was very profound. And at the same time, there was a parallel watching my grandmother's health decline. Yeah. So I said at that moment, I'm interested in being a doctor that caters to women.
To cater to women. Okay.
Yeah. And
so salute to you for that, because I'm sure you're doing a great job, and you have I already know that you're passionate about it, because you came with a book that has a step-by-step manual. Exactly, for me. Okay, so now did you start off under organization, or did you have your own practice out the gate?
So I did 4 years of residency back home in St. Louis. I went to med school in Ohio, and I really knew that I wanted to work in the community out the gate before I even graduated medical school. I went to medical school on a full ride scholarship with the National Health Service Corps. And the National Health Service Corps, the agreement is that if you get this scholarship, utilize the scholarship, we will pay for 4 years of your medical school if you go to service an underserved community. And it was perfect because that's what I wanted to do anyway. I wanted to work in the community. So out the gate, I knew that I was going to work in the community facility.
Okay.
So I chose my medical school based on that as well.
And being a black doctor, what was that? What was the trials and tribulations of that, like coming out of college and trying to get into it? Because I already could tell you're outspoken. I heard you giving some direction in the studio, so I already know that. I don't need to be around you that long to know who's the boss. So
well, not exactly, but it wasn't always that way, right?
Okay.
You know, when you go through some beating, microaggressions, you learn to stand up for yourself, right? So sometimes I would say that I wasn't always that way. Unfortunately, it was when I was pushed to a breaking point due to the microaggressions, racism experience. Even to this day, going into the operating room and anesthesiologists who don't want to raise the table so that I can operate because of what I look like, and I've had an anesthesiologist curse at me before. And so, just dealing with some things that are underlying racism and then some that are just very in your face. It's tough because being an OB is already tough.
Right.
We deal with 2 lives.
I've seen, what was the name of that show that used to come on? It was a bunch of them, but it was one in particular where the lady didn't want the Asian lady to operate on her. What was that doctor show that was on for years? It was on TV. It was like a sitcom, but it was like a bunch
sitcom?
Yeah, it was.
I don't know. I don't watch much TV.
Okay, so then I won't.
So I'm not.
So anyway, it was a scene where somebody had a serious injury that they needed to be operated.
Grey's Anatomy?
Yes.
Okay.
Grey's Anatomy, you got it.
Right.
And they needed someone to be operated, and the lady said it in another language that she didn't want that lady to operate on. She didn't know that she was married to.
That happens.
Yeah.
It definitely happens. Yeah, I used to see
do you feel like as a doctor, like, well, didn't die then? Like, or
you don't. You still.
Didn't
Here's
die
the
then, it's
thing.
kinda
You
crazy,
still
I know.
took an oath, right?
Right.
And regardless of how people feel about you, you still have to care for them. Now they can fire you.
Right.
Right. They can fire you as a doctor, and then just your hands are tied. But if they don't fire you, then you still have to do the job. Like you have to do the job regardless of whether they like you or not. And you feel a certain type of way, but at the end of the day, you're a doctor.
Right. Okay. So that being said, going into the practice and dealing with the racism and the everything that comes with that, being a woman, is that another thing too? A black woman?
Oh, of course, especially in a surgical field. Right. In a surgical field, they don't want to see you coming. You have to work twice as hard to be just as good.
What does that mean? They don't want to see you coming?
They really don't want to see you coming because they're not used to. They don't think that you deserve to be there, right?
Okay.
So you have people, I've had, like I said, anesthesiologists, other ancillary staff in the room that when they find out, what you look like, because January is like one of those names that it could go either way.
It can go either way.
It can go either way. So when they see you coming, then it's just like,
right.
You deal with a lot of issues, especially being in the surgical field, like across the board. But being in the surgical field, yeah, it's kind of tough because historically surgeons are white men.
Right.
Like I was trained by 120 private physicians, and a majority of them were white men and older.
And is that a woman's choice that a lot of women just don't go into that field because of that, or do you feel that it's just men push women out of that on purpose?
No, we're going into it now.
Okay.
Like the tides are really changing. You have more women who are becoming OBGYNs, more black women who are becoming OBGYNs. I know a ton of phenomenal black OBGYNs who are women.
Okay. So if you just tuned in, we have Dr. January on the producer's point of view, and she has a book, and this is my book.
Yeah, it's your book. I'm going to sign it. Well, no, you need to come to the book signing.
That's Saturday?
Sunday.
Okay, I'm available. Empowered Motherhood by Dr. Ebony January. So now, obviously I'm a man, so I'm going to speak from a male's perspective, but I have 2 sisters that I love and I've seen.
Good.
And I have 1 son that I watched be born, so I understand the process of things. But let's just talk about what it is for you to be a pro woman, pro life, pro making sure that everything goes right in the operating room in a society where I hear a lot of women complain about the services. A lot of black women complain about the services that's being, I guess, represented for our women.
Well, It's really tough because, you get lumped into the category of doctors that don't care, right? And so I have been educating and advocating for women since I started working in the community. I went to work for FQHC, which is a federally qualified health center in St. Louis. And you saw so many women who didn't understand health. They didn't know about their health. And so I found myself educating. And then I found myself going out into the community, doing more community events to educate women. And so being that I know my heart, I know how I feel about my patients, and I want them all to be healthy. It's tough when you see people that are your colleagues that unfortunately just don't care, or they are treating that patient differently based on what they look like. So it's really, really tough. And so that's why I said, you know what, I'm going to be out here, I'm going to advocate, and I'm going to also help bring other doctors on who I know are phenomenal physicians, so that we can change the narrative and break down the barrier between doctors and patients. And if we can't change systems, then we got to meet people where they are and teach them how to advocate for themselves. And also we have to use ourselves as examples as Black doctors. So.
Okay, well, round of applause for that. So the book now, how long into your career did you decide that, you know what, I'm going to make a book because this needs to happen? Because this is a very intricate book. It's not just like a book, a novel or nothing like that. This is like a step-by-step
it's a resource
booklet.
guide.
Right.
My first book, Educational Athlete, Why Every Successful Student Needs a Coach, I released that in 2018 because I was doing a lot of mentoring, and a lot of women, or not just women, but people in general, were coming up to me asking me for help to, mentor their child. And so I said, I'm going to put together a book in FAQ form. That was my first book. But when it came to Empowered Motherhood, I said, this next book has to be to educate people, because I keep getting asked the same questions over and over again, and that people don't know what they don't know. But at the same time, there are a group of people who just have no idea what questions to ask. They don't know that they need to be empowered. And I said, I have to put it together in an easy format that they understand. And also not just women, but the people who care for women, because we are in crisis, right? Black and brown women are dying at 3 to 4 times the rate as their counterparts. And so what's happening is it's leaving us with single dads, right? Who are raising children. It's leaving us with grandmothers, aunts, uncles who are having to step in to help that single dad to care for those children. So how do I put something in place to help prevent some of these things, and prevention through advocacy and an educated advocate, right? And so a couple years ago, I said, I'm going to put together a book. And that's what I did. It took me about a year or so.
And now you on the book tour in New York City, and you stopped in the Matrix Studios to see DWI. I am so happy that I got that call, because it's not a conversation I would go searching the internet to have, but it's one that I'm definitely willing to have because it's very necessary. And my community, anyone that follows me, knows that I definitely stand with all women and all things that's life and kids. I work in schools with kids, and I really care about that. So I want to know, when making this book, like, did you work on it solo, or was it other contributors?
Yeah, I worked on it solo. It was something I did a lot of research, made sure that I had, the right information, accurate information, and really a lot of the hot topics that I feel like patients needed to know about, what we commonly see, and also the top causes of maternal morbidity and mortality. So I wanted to address the things that were causing the deaths, right? And so it was just me, but I wanted to take my time to put in things that I felt like was necessary for people. And I'm very grateful for you having me here, and for you being willing to spread the message, right? Because all too often men are just innocent bystanders in the labor room, and it's like, no, we need you. Like, pregnancy brain is very much a thing, and so when women are too much in pain, or their emotions are all over the place, we need you all to help to advocate, and advocate, like I said, from a place of knowledge. And so I'm very grateful that men are stepping up. I've met some along this journey, this book tour. I've met some amazing men who are really stepping up for women, and also support people, doulas, midwives, who are really stepping up to be advocates for women. So I'm very, very grateful.
So speaking of midwives, when my son's mom was pregnant, I remember I was going to the hospital. At the time, it was a storm in Canada. She born in Canada. Storm in Canada, snowstorm, had the drive. This is my first kid, so both of our first kids, so we don't know what we're doing, but we know we got to go to the hospital. We go to the hospital. We got a midwife now, so we go to the hospital. Now, I'm expecting when you go to the hospital that there's nurses, doctors, people running all around doing stuff.
Yeah.
No, it was one room, just the three of us in the room, and that was it for hours. So I'm like, all right, where's the operation table? What's supposed to happen? Then the midwife she must have to go down the hall to get something, leaves out the room. My son's mother's on her hands and knees, you know, waiting for that time. And she's not back yet, but my son is coming out. So now I'm like,
one of those.
what I got to do now? Like, so, you know, I remember that moment. And I'm the one that don't like to be in hospitals. I don't like blood. I don't like hospitals. But it after that experience, I was able to speak about it more, and be more comfortable, because I seen the process was like that. I was like, why don't more women do it on their hands and knees? The baby he came out smooth, no pushing. Well, I'm sure she was doing some pushing, but it wasn't a struggle.
The uterus was pushing as well.
Right.
Yeah. So we do, and that's something that I see commonly online now. We're in the day and age where everyone, you know, has a platform, midwives and such, who, you know, they have their way of doing things, and doctors have their ways of doing things. And you're right, and that's something where you see them spreading the message like you don't necessarily have to deliver on your back, and you don't. Right. You can deliver on your hands.
I think there's more pressure to push the baby up with gravity than to let it come down, no?
Well, yes, you're right. But it also,
I'm thinking like a man now, right now.
But
I'm
it
trying
also
to figure out an
depends
easy
on
way.
the pelvis of the lady, right? The comfortability. Some people are more comfortable on their back. Some people are more comfortable on hands and knees. And so there are various positions that you can deliver in. It doesn't necessarily just have to be on your back, but some people prefer it that way. But you're right. Gravity is very much there. It can spin the baby if the baby's facing a different way. So we definitely recommend it if it's, you know, some people, they don't have much feeling when they have the epidural. So sometimes they don't want to get on their hands and knees. But we are very, I personally try to give a choice, right? How do you want to deliver? But if I think it's a big baby, then we might need to reposition you a different way so that we can get to the baby's shoulders, right?
All right, so listen, hold that thought, because when we come back, we're going to talk a little bit more about the book tour and all things that are going on with this amazing book, and the procedures of all things doctors and women related. So ladies, y'all tune in. I'm about to play some R&B, so y'all get in the mood and stay right there.
We're throwing it back. We're throwing it back. The new Party 1019, New York's #1 for throwbacks.
What up, y'all? This your girl, Little Mo, a.k.a. Young Meezy, also known as the godmother of hip-hop and R&B, doing it every night with my boy, DWI. Don't touch that dial. Don't touch nothing else. I'm going to come get you. And you know I will, because I'm somebody's mother, and I don't play that. Say that. Heard it, y'all.
Okay. All right, back in the building. We got Dr. Ebony January is in the building, and January is not the month she was born. What month were you born? Let's just clear that up. July. Okay, so you are either Cancer or Leo. Also. Leo.
Big Leo.
Big Leo energy. My sister's both, so she I don't know which one she. I think she claims Cancer more than Leo.
When's her birthday?
22nd of July.
Okay.
Yeah, so she's on the cusp.
Yeah,
so
she's right on the cusp.
She like to play both sides of the fence. But it's cool. It's great to have you. And if you just tuning in, there is a book that's out. Where can they get this book from? Empowered Motherhood.
They can get it on Amazon, Amazon.com, Empowered Motherhood.
And it's not a small book either, y'all.
No, it's a
big
reference guide. You can flip back through it. You can tab it, whatever you need. Mental health resources in there. Everything that you need to be
These are the kind of books I like to read, too.
Yeah.
And I would like to think that I'm not like a reader where I just want to sit down all day and just read a book. I need information.
Yes.
I need to be able to go front or left, whichever way, and then put it down and then go.
Exactly.
And I salute all people that can just get a book and just love to sit on the train and all that. My brain be thinking about 1,000,000,001 things, but the information is very good, and I like the way that it's detailed. It has colors and pictures. I sound real premature right now. Colors and pictures,
but that's how people learn, and
yeah.
I did it that way intentionally because I know that medical information can be very, very complex, and I wanted it to be in a format to where people really understood, they can learn. I wanted to be able to translate. There are some bigger words, but doctors are telling you big words.
Right.
And so you can always reference what they're saying, because many times we'll tell patients something, it'll go in one ear, out the other, or they'll nod like they understand, and they absolutely don't. So I always tell people, write things down, be okay asking, information or asking questions for more information, or having them print out information that is easy for you to understand. But that's why I wrote it the way that I did.
Right.
I wanted you to be able to have a conversation with your doctor, but also improve your knowledge base.
Now, are you a big writer? Do you enjoy writing?
I do like to write. I do.
Because doctors, they say y'all don't have good handwriting. So
We
do you write
don't.
so that people can read it, or do you write so that
Listen, so
only you
that
can
I
read it?
can read it. And
What
sometimes
about the prescriptions? How do the people that work in those pharmacies know how to read y'all handwriting?
Well, usually, sometimes we have to, our name will be printed on it. But sometimes they may get a copy of our signature so that they kind of know.
I'm thinking about the good old days. Right now, it's probably all
Yeah,
in the system.
exactly.
You just go and scan a QR code, and the medicine comes out.
Yeah, my handwriting's terrible.
So, all right.
should be
So,
better.
right, it should be better. Right?
It should be better.
We don't even need to use it as much anymore. That was just
No.
kind of crazy. Our generation came up, all we knew was typing, penmanship, and script.
Cursive, and
Yeah,
now they
and
don't even teach cursive.
It's like, why'd y'all do that to us?
Exactly, terrible.
And if we was to write it, I guess we could write in code now, and our kids wouldn't be able to understand
No, not at all.
some of the writing.
They wouldn't.
But so you have the book out now. You're on a book tour. You're in New York City from St. Louis. You still in St. Louis, or did you
Yeah, I
move
live
around?
in St. Louis.
All right, I got a few friends out in St. Louis. They
Oh,
was talking
yeah?
about the little tour, so that's cool to meet you there. I can say, I met a doctor from St. Louis. If you get pregnant, you go holler at her. Is it so? All right. Do you do a lot of deliveries?
I do a lot of deliveries. I've delivered over 8,000 babies to date.
Oh, look at you bringing life into the world.
Yeah. So right now I do travel work, some contract work, because I have other businesses and such that I deal with, and I do. So my time is limited.
Yeah.
But I do a lot of advocacy work. I do a lot of training on culturally competent care, and like I said, a lot of education in the community is what I do.
Do we have a call? Somebody calling in?
Uh-oh.
I didn't expect that, but I guess we got a caller. So caller, you live? I don't know who this is gonna be, but let's see. Hello. No. I guess they don't want to talk to us.
They don't. That's okay.
They banged on us. I mean, it could have been because I didn't post it that you was gonna be here. I thought maybe you had some of your followers call us up.
No.
All right, so yeah, give us some contact information and anything that I might not have touched on that you want to speak about social media wise, because this video will be your video where you can use, clips. So you can use this platform to have you some content. I see you came with your content crew, so shortage of content.
My team. I come with a team.
Mm-hmm.
Yeah. So one, you can follow me on Instagram, Dr. Ebony January, Dr. DOCTOR, Ebony with an I, January just like the month. On Facebook, I'm Dr. Ebony January, just DR. You can email me. People reach out to me all the time to, just ask me questions, concierge visits. I do those a lot. And a lot of times people want to know more about a specific topic. And so they'll either DM me or email me, and then I'll create content surrounding those things. So, but don't be afraid to ask. Definitely reach out. Don't be afraid to get a copy of the book. Even if you're done, if you're an older woman, you have a niece, a nephew, get a copy of the book, because we definitely need everyone. Maternal health is everyone's responsibility. We need a team. These women really need people that are around them that are educated, not just the innocent bystander in the room. We need people that are knowledgeable about various topics.
And last question, what else would you say that women, if they go into a hospital that's not represented with black women, like what questions or how should they position how they are being treated? Because I feel like when I hear, like, if I go to a doctor, if I go to a dentist, I don't like how they treat me, it's either I'm not going to go back or I'm going to tell them what I want to be done. And I don't know if that happens a lot, because maybe it's a lot of pain, there's a lot of things happening where it's out of the woman's control. But what can women do if they're in an area where it's not, they don't feel like they're being represented?
You can absolutely ask for a supervisor. You can ask for the charge nurse. The charge nurse can get you someone who's in the supervisor position. They can get a patient advocate as well. So don't be afraid to ask and go above the doctor or above the nurse if you don't feel like you're getting the care that you deserve. There are processes in place to help support you in this situation. So don't be afraid to ask for a patient advocate.
Okay. And you heard it here first. And make sure, if you're listening to the show now live and you want to go to the workshop on Sunday, give them the information about that.
So the book tour is at the Chelsea House in New York City from 3 to 7 p.m. We'd love to see you there. The flyer is also on my Instagram if you guys need the address, but it's the Chelsea House in New York City.
Okay. You heard it here first. This is the producer's point of view, and we are signing off. Stay tuned. We got Outside the Booth coming on next, live on Party 101.9.
What up? It's your girl, Justina Valentine, and you're rocking out with the Matrix Studios Network. They're bringing you the hottest new artists, making the underground mainstream. Check them out at www.thematrixstudios.com.
The kids have their station. Now you have yours. The new Party 1019, New York's #1 for throwbacks.
Ladies and gentlemen, welcome to Outside the Booth,
Hey now.
where we talk to DJs and special guests now at this